Let's start this anytime.
Good.
Alright, well, I'm Miguel Saucedo, and I'm here to inform you about a specific heart disease called congestive heart failure. But before I start on that, heart disease is a big problem in the U.S. It's the #1 illness in the U.S., and it kills millions of people in the U.S. and around the world. And I'm sure we all have family members here who have some sort of heart disease, and maybe your grandma and grandpa passed away because of it. And what congestive heart failure is means that the heart is too weak for it to pump blood throughout the whole body. And it's a long-term chronic disease, so once you get it, you can't just get rid of it. You have to live with it for the rest of your life. So what it does, it affects both sides of the heart, both left and right. And pretty much like a normal heart rate, I'll just show you with my hand. Like this would be a normal heart rate. When you have congestive heart failure, your heart just barely twitches. So blood doesn't get through the rest of the body for like your legs. Your blood might not reach your legs, so that could be an issue for circulation. And also what it does is congestive heart failure enlarges your heart. So they say your heart is the size of your fist. So someone who has congestive heart failure, their heart might be a little bit bigger and a little bit deformed, and that's never good. And one of the causes for congestive heart failure is coronary artery disease. And what that means is that your blood vessels are, they could be filled with fats and stuff. So a normal blood vessel could be this thick, but if you don't eat right, they get clogged and they end up being like that small. So your heart has to work extra hard in order for it to push the blood through. And some of the symptoms for congestive heart failure is just fatigue. You can just feel sleepy all day, don't feel like doing anything. And another thing might be shortness of breath. When you're just walking around, you can just feel a shortness of breath and tired. Another thing is you can feel like a tingle in your legs, or you might not feel your legs at all. It could be numb because your heart's up here, and when it can't pump blood to your legs, it's a long way down. And early diagnosis is pretty much the key part in congestive heart failure. All you need to do is go to the doctor if you're having these symptoms and get an echocardiogram or an electrocardiogram, and that's just painless. They just put pads on your heart and they check your little the waves that your heart makes. And treatments for congestive heart failure aren't really treatments, but it's a way to prolong your life. When you have congestive heart failure at a maximum level, you need a heart transplant. So that's how serious it is. And when you have normal congestive heart failure, you can adapt to that through getting into a diet or exercising more. And you can have surgery for it, but you know that may or may not help improve it. Surgery could be coronary bypass surgery or angioplasty, for instance. And for the other things, you can also take medicines which help increase your heart. It gives it like a boost, and you take it once a day for the rest of your life pretty much, and it just speeds up the heart. So diet is very important. People who have congestive heart failure need to be on a low sodium diet, because sodium, which is salt, it increases the water in your body. It makes it hold up more water, and the more water your body holds, the more your heart has to work. And doctors always stress that you eat a lot of fish, because I'm sure you've seen commercials where they have little fish oil pills that are good for the heart. It also has omega-3, which is something else that is good for the heart. Another key thing is losing weight. People who are overweight tend to be more at risk for heart failure because they have a lot more weight to carry around, so their heart's constantly working and working. So exercise is another key thing during this congestive heart failure, because if you, not only are you losing weight, but you're also strengthening your heart muscles so they can be stronger to push the blood out to your body. And just to sum this all up, congestive heart failure, along with other heart diseases, really is a serious thing. And most people are unaware of these diseases or aren't educated enough. So for a young person, they might say, oh, I'm too young to